is quite serious.
It's a drastic measure. The army called in to assist the sick in South Africa's public hospitals. Nearly 3,000 soldiers have been drafted into wards, a short-term measure to try and keep public institutions going and protect a handful of doctors and nurses who showed up to work.
It will be a sad day if we can find our health institutions becoming military bases. But the coming in of the army and the police is again in the best interest of our people, but also to safeguard those that have availed themselves to work.
This hospital is functioning only at 30%. Medical staff refuse to come back to work until they get an 8.6% pay hike. Unqualified volunteers cope as best as they can with sick patients.
She had like a fit on the table, and all of us that were standing there, we didn't know what to do. We were like running around screaming and to get someone extra to come help them.
Despite a court order forcing essential workers to return to work, many haven't. This is a snapshot of what it's like in public institutions across the country, and workers are digging in their heels.
At the end of the day, they live from hand to mouth. It's unacceptable that people want to use some of the things that are happening to blackmail the workers. The workers' demands are legitimate and fair. It's government's responsibility to actually come on board and start acting like leaders.
It's a tense standoff.
Police are stationed outside public hospitals and they say they're ready to deal with troublemakers. Government officials and striking workers are miles apart. Neither side seems willing to compromise. And this is now the second week of a nationwide public sector strike.
It's unclear how long the strike will drag on. Until an amicable solution is found, police and the military will have to hold the fort. Haru, Mutasa, Jazeera, Johannesburg, South Africa.